Hi, my name is Brittany Hayes. I'm a student at the Chicago School of Professional Psychology, and this is my firsthand experience with maternal health and the issues that contributed to maternal health and maternal mortality. My firsthand experience, me and my partner, as you've seen her in the other video, expressed certain things that she has gone through dealing with the healthcare system, and I want to share more about that because there were issues receiving services before she was pregnant, like 40 to 60 days for her to receive any type of information or to confirm that she had insurance or not having insurance. She does have a pre-existing condition called hidradenitis suppurativa, also known as HS. And with this pre-existing condition, it is considered a disability. So with that, there's a process as far as disability. There's a process as far as trying to get Medicaid. And I even went to try to get healthcare for myself and add her to my health plan. But because she qualified for Medicaid, I couldn't add her and she had to do her own health insurance. So that caused more issues with that. Also, it was a staggering as far as the system approving her for insurance beforehand. So after she got pregnant, of course, the government stepped in and gave her insurance for being pregnant. However, the services that they provided to her, she still hasn't quite received as far as she's concerned. We verified that she was pregnant in October. And when we verified she was pregnant in October, she was applied for the governmental assistance such as the insurance and like food stamps and WIC. However, she hasn't received any food stamps cards since October. She hasn't received any insurance card, which all the providers are asking her for when she goes to her appointments. But we can't provide it, and they can't access her information either because there's an issue within the system. Contacted supervisors, we've contacted her caseworker. Nobody has adequate information or has gotten back to us as far as the issues concerning the healthcare. I'm looking into a lot of different areas as far as help and services, but due to the effect that a lot of people are looking for services as well, it's kind of like we're on the back burner. So it's just important for me to try to make sure that she's healthy. During this entire process, because of her pre-existing condition, a lot of times she does not feel well enough to get out of bed. She does not feel comfortable with eating sometimes, and she's pregnant. So with these situations, I have to reach out to providers, and they rarely to ever offer any type of information because she has a pre-existing condition and she's pregnant. They don't know which medications to give her. As she mentioned in her video, that we have to a lot of times go to the ER. With the emergency room, it's like one time we went to the emergency room and she had a wait period of 19 hours. I had to bring her food, and due to COVID restrictions, I can't be with her. They had her down in the emergency room for like 16 hours another time until they were able to give her a room. A lot of bedside procedures as far as because of her condition, she has abscesses that grows on the inside until it's ready to bust on the outside. But if it doesn't, it needs to be lanced, which is needs to be cut open and drained. However, if the abscess is too deep, most providers don't feel comfortable with doing it at the ER, so they send her up for to be admitted, and then she has to see her surgeon whenever he gets there. It's hard to get in contact with his office. She's left about at least 12 messages, and he has yet to reach out to her, receive any type of medication. And even while she's pregnant, she's still offered oxycodone. She's still offered morphine as a way to mitigate her pain. So even with being pregnant, she's still receiving control 3 type of medications to try to control her pain. But even while she was at the hospital, she had like skin cultures, and the skin cultures came back to where she had a particular bacteria infection that they couldn't treat normally. They'll give pills and they'll send the patient home, but because she's pregnant and has HS, they didn't know what to give her as well. So they put a midline her on, which she still has today, where she injects medication or antibiotics 3 times a day in her arm. that's supposed to help her bring her white cell blood count down. With this condition, she's had multiple surgeries. Last year, she had a surgery in her armpit. They removed her entire armpit, and this is whenever she has surgeries, none of her wounds are closed. None of them are sutured closed. Everything is completely open, and they just want the skin to heal. She's had surgery on her breast where they cut literally from the top of her breast all the way around, completely open to the point where you can literally stick your entire hand in and touch the bottom of her breast. And so this current surgery that she's had, we had an issue where, because due to pregnancy, her hormones is skyrocketing. And because her hormones skyrocketed, it pushed her condition even worse. So it just expanded a lot of areas everywhere. We had issues with our stomach since last year. Before she got pregnant, he still didn't do surgery or anything like that. He just did a lot of bedside procedures, even in the hospital and at his office, to drain them, but they weren't going away. So when pregnancy happened, it just got worse. So she went to see him a week before she had surgery. She had surgery 2 weeks ago. She went in a week prior, and the area was inflamed. However, he thought that by just opening it, it would go away, but it did not. It got worse. So before we even had the surgery 2 weeks ago, he told that he's going to go in, even the day of the surgery. He said the exact same thing. He's going to go in and remove the pocket, and if he sees anything, he's just going to go take it out. So before before she went in, she signed a consent form, and they took her back. So after surgery, he gave me a call back, and he said verbatim, I got all the disease. So mind you, at this point, she is 17 weeks pregnant, and he went in and did surgery. Okay. So coming out of surgery, she had a catheter, and the nurses and I didn't understand why she had a catheter, because I know one of the wounds is closer to her vaginal area. So we just considered maybe he just, took out that area and left it there. The next day after surgery, the wound care doctors came in and removed her bandages. When they removed her bandages, the extensiveness of the surgery completely took the breath out of me, because of the simple fact that he went in and not just did that area, but he did the stomach, and he did 12 additional areas that are completely open, to the point where everybody was confused. Everyone didn't know how to move forward because of the extensiveness of the wound, the area of the wound, and how deep they were. We ended up having to take the catheter out, but the surgery was so extensive to the point that she did not have any way for her to use the restroom at any point in time. So we're to the point where now we have to use a urinary device that I had to buy, because the hospital didn't have anything for her to use to cover the area that did not aggravate the wound. I do have pictures on the next slide showing the wound and how extensive it was, the wounds and how extensive it is. And with this, they had her on morphine every 4 hours, oxycodone on the 5th hour, and then it just kind of reversed out, kept going after that. So with that, she found more helpful the oxycodone than the morphine, because the morphine was more of a just right then and there. She spent a week in the hospital after the surgery, and the care was amazing there, but the understanding the health literacy was absent, because a lot of people didn't know what was going on. The infectious disease doctor, the family care doctor, the surgeon, he just came and looked at it and was like, oh, okay, it looks like it's healing. But because the nurses didn't know what to do about it, I was in the hospital doing her wound change. Even to this day, I'm still doing her wound changes at home. And we've called to get certain materials for the wound change. She was sent home with a wound vac that took a long time, because she had to get pre-approved and go through the system. And it was just a lot. It's honestly a lot. And then now, with her still being pregnant, her having pregnancy symptoms, the baby's moving, and by the grace of God, the baby is still okay. and he's very active. But with this trying to use interprofessional collaboration was a complete lack. No one knew what to do. Everyone had their own opinion, and then it was kind of like we're going to go with the best option. So me being there with her forced me to, ask questions, to also do my own research, to make sure that I'm advocating for her about the things that she does not like, the things that are not working for her, to make sure that her care is effective to when she leaves and comes home. This entire experience is mind-boggling still. She's still having issues with her white blood cell count. We still having issues with connecting with providers. Also, even when we went to go see the surgeon for the follow-up, he didn't look at came in and looked at the wounds, but didn't touch them, just stood aside and just stood back like, oh, okay, they're healing. And then the nurses came and packed it. And when they did come and pack the wound from the follow-up, they packed it wrong to the point where the material that they used stuck to the inside of her wound and not the outside, which caused her to clot really, really bad. It clot to the point where it almost looked like tissue was hanging from her thighs, also from her stomach. She was bleeding heavily. And we had to contact the doctor and contact the services to provide the at-home antibiotics that she was taking in the hospital. And because they had a mix-up and they didn't give her the right dosage, she was bleeding because the heparin that she was taking, she wasn't able to take. So these consistent issues and these consistent problems, it places me at a point of fear. It places her in a point of fear, and that affects her mental health. I have to check with her almost every day to make sure her mental health is okay, to make sure that she's all right, that she still has, a will to keep pushing, and, because there's a life inside of her. We have a life. I'm her partner, but it's hard for her to function. So for her not being able to do just normal things as far as stand, to go cook, to go pee normally, it has an impact. So for us to still figure out different services for us to use, even reaching out to people for us to talk to, or things, people to get things done is a consistent problem. And I'm sorry, I'm getting a little teary-eyed because it's to the point where we have no help. And I'm doing everything in my ability to make sure that she's okay. I'm still in school. I still work 2 jobs. We still have bills to pay. There's still medicine to go pick up, or medicine to, try to get to mitigate these issues that she's facing. And we're to the point where you have to choose between medication or bills. You have to choose between proper care or, just doing what you know to do best. And it hurts. And I don't like it, and it's unfair. But what can we do? This situation happened. The extent of the surgery was not properly disclosed. The wounds weren't properly disclosed either. And it's very hard. And it's like I have to take everything that has happened and continue to move forward, because I need for her to have a place to stay. Despite the things that we're going to, I face eviction every month because I have to make choices in order to make sure she's okay, to make sure our child is okay, to make sure that she doesn't become infected or anything like that, and that puts just a strain on everything else. We continue to push on and find better ways. And I honestly believe if I wasn't here and I didn't have the knowledge, she would be another case connected to maternal mortality. Honestly, I can honestly say that. And it's important for maternal mortality to decrease. It's important for Black women and maternal health to take priority, because it's not fair to the infant. It's not fair to the woman. It's not fair to any of us. And I'm just her partner. and I'm doing everything in my ability. And I can only ask her mentally, hey, are you okay? And she's so strong, and she puts a smile on her face, and she keeps pushing, and she keeps going. And I have to do the same. But Black women, maternal health is a problem, and it needs to be addressed. It needs to change. And if my story, this story, firsthand experience, her story, can help change that, then so be it. Because now you can put a face to a problem, a story to a problem. Thank you for taking time out to watch this video. Thank you.